Diarrhea, types, causes, complications and treatment. Going to the bathroom, having a bowel movement, pooping, no matter what you call it, stool is a regular part of your life. When you have loose or watery stool, it's called diarrhea. When you have diarrhea, you may need to quickly run to the bathroom with urgency, and this may happen more frequently than normal. Although most cases of diarrhea are self-limited, happening for a fixed amount of time and steady level of severity, sometimes diarrhea can lead to serious complications. When you have diarrhea, you lose water and electrolytes along with stoolie. This type doesn't need treatment and it usually goes away after a few days. It's not uncommon for many people to have diarrhea several times a year. It's very common and usually not a major concern for most people. However, diarrhea can be serious in certain groups of people, including young children. For each of these people, diarrhea can cause other health problems. In general, diarrhea is self-limited and goes away, resolves, without intervention. Call your healthcare provider if you have diarrhea that fails to get better or go away, or if you experience symptoms of dehydration. The cause of most self-limited diarrhea is generally not identified. The most common cause of diarrhea is a virus that infects your bowel, viral gastroenteritis. Antibiotics can change the balance of bacteria normally found in the intestines, allowing certain types of bacteria like C. The symptoms you can experience when you have diarrhea can vary depending on if it's mild or severe and what the cause of the diarrhea happens to be. There's a link between severe cases of diarrhea and a medical condition that needs to be treated. If you have severe diarrhea, you may experience symptoms like fever. If you have these symptoms, call your healthcare provider and seek medical attention. But if you ever see red blood in your stool or have a bowel movement that is black, that could be something more serious. For the majority of mild diarrhea cases, you won't need medical attention. These cases are self-limited, only lasts for a fixed amount of time, and get better without medical intervention. The key to mild diarrhea is supportive therapy, staying hydrated and eating a bland diet. More serious cases of diarrhea may require medical attention. These tests can include discussing a detailed family history, as well as physical and medical conditions, your travel history, and any sick contacts you may have. Doing a stool test on a collected stool sample to check for blood, bacterial infections, parasite and inflammatory markers. Doing blood work to rule out medical causes of diarrhea such as a thyroid disorder, celiac sprue and pancreatic disorders. By using an over-the-counter product like bismuth subsalicylate, Pepto-Bismol or Kaopectate, you'll usually feel better very quickly. If your diarrhea is caused by an infection or parasite, you'll need to see a healthcare provider for treatment. A general rule is not to use over-the-counter medications for diarrhea if you also have a fever or blood in your stoolie. Your healthcare provider might prescribe an antibiotic or other medication to treat an infection or parasite that's causing the diarrhea. Once the cause of the diarrhea is identified, diarrhea can usually be controlled. Introducing probiotics can be helpful in some cases and some healthcare providers feel that it's worth a try. The rules for managing diarrhea in an adult are different than in children. Always call your child's healthcare provider before giving your child any type of medication for diarrhea. A tip for managing diarrhea in an adult with over-the-counter medication includes taking 2 tablespoons of Kaopectate or 2 tablespoons of Pepto-Bismol after each loose stool. Several things you can do to care for diarrhea include drinking plenty of water and other electrolyte-balanced fluids, like diluted and pulp-free fruit juices, broths, sports drinks, Gatorade, and caffeine-free sodas. By drinking plenty of extra fluids, you are protecting your body from dehydration. Instead of picking greasy, fatty or fried foods, go for the brat diet, bananas. Foods and drinks that have caffeine can have a mild laxative effect, which can make your diarrhea worse. This is usually temporary and it means that you need to avoid items with lactose, dairy products, until your diarrhea is gone. If you have diarrhea, try adding these foods into your diet. Potatoes. If your child has severe diarrhea, call your healthcare provider. Young children are at a higher risk of dehydration than adults. You also can treat a child's diarrhea the same way you would an adult case. Over-the-counter medications can be dangerous in young children, and all treatments of diarrhea in children should be guided by their healthcare provider. If you're experiencing any of these discomforts, there are a few things you can do to help, including sitting in a few inches of lukewarm water in a bathtub. Washing your hands with soap and water after using the bathroom, as well as cooking, handling, and eating, is an important way to prevent diarrhea. Rotavirus, one of the causes of diarrhea, can be prevented with the rotavirus vaccine.